So it's time to talk about the case of the day. Let's see, who should be the case of the day? I had a few interesting cases of the day today. But you know what I had? I had a lot of people who were coming in complaining of a cough. The most common cause of a cough is a cold. And so a lot of people having colds, some sinus infection, some people who thought they had bronchitis. And, you know, for the most part, in an adult anyway, bronchitis is just a cold, a viral cold, instead of an upper respiratory infection. Upper respiratory infection always means cold. They mean the same thing. An upper respiratory infection is a cold. Well, bronchitis is kind of just a lower respiratory infection. It's still, in adults, viral, and you just need to wait it out. And yes, it's a terrible cough. So let's talk about what you can do when you have a terrible cough, regardless of where it's from. So, by the way, in kids, some studies have shown that actually antibiotics are useful because bronchitis can tend to be bacterial or more quickly introduce a bacterial component to the viral bronchitis. And so that's why I say in adults. But anyway, well, what's a cough? Why would many experts say you shouldn't try and stop coughing? You know, it's kind of an interesting thought. Like, whenever you're sick, you're like, oh, I was coughing so hard and my chest hurt and my neck muscles and there's constant nagging and I can't work at work. I'm like, everyone's staring at me and everybody hates to be coughing. But what a cough is a cough is your lungs' way of saying you can't come in here. You know, the only thing that should be going into your lungs is air. Occasionally something else like food, any kind of solid, liquid, drainage, mucus. When it's trying to get into your lungs, the way you stop it from getting into your lungs and the way you tell it to get away from here, get out of here, you can't come in here, is coughing. So when you go to the doctor or when you're sick and you're trying to handle this at home yourself and your goal is to stop coughing, you're trying to say, I don't want the ability to clear my lungs. I don't want the ability to keep fluids out of my lungs. I don't want to be able to protect myself from pneumonia. I know that sounds silly, but that's what you're saying when you're saying I don't want to cough. Now, there are things you could do when you have a cough, but one of your goals shouldn't be to stop coughing. A cough is very protective. It's just like if you swallowed poison. You wouldn't say, oh, I don't want to throw up. I'm sick of throwing up all this poison. No, I want to get this out of my body. And so when you're coughing, you should want to cough. But what you should want is to be able to have a little bit of control over your cough, and maybe to be able to make your cough not painful. And so let's talk about how you can do that. Well, so a cough most of the time is drainage coming down the back of your throat, whether it's draining from your sinuses or draining from your nose, or both. It's draining down the back of your throat and trying to get in your lungs, and your lungs are trying to keep themselves clear of fluid and only keep air in them, and they're making you cough. So one of the things is one of the things you want to do is be able to control the mucus. And if you picture a very thick, viscous mucus, one that's more like a thick pudding, I don't know. If it's a very thick mucus, it's very hard to manipulate, it's very hard to control, it's very hard to use muscle movement to change it, it's very hard to move it around. And so one of the things we want to do is we want to make your mucus very, very thin. When you talk about a dry cough, a nagging cough, an annoying cough, a cough that makes you gag, a cough that makes you choke, a cough that makes you throw up, coughing fits, these are from thick mucus. These are from very viscous drainage, very thickened drainage. And so a lot of times it's so thick and well, slimy that it's trying to slide down. Like most of the time the mucus should slide down into our stomach. It hits the acid in our stomach and it's destroyed and recycled so that those proteins and nutrients can actually be reused. But sometimes maybe half of it sliding down into our esophagus, into our stomach, and the other half is trying to slide down into our lungs. And so now you have a piece that's stuck halfway in both sides, and that's when you're like, oh my God, I'm choking. You start gagging, you have that horrible fit, you start wanting to throw up. It's because it's kind of stuck in both places. But if you have thinner mucus, or if you're able to immediately thin that mucus out, you can get over it really quickly. I with my own family, have had times where they're sitting there and they're just like, oh, they're getting so frustrated, like, oh, I can't stop coughing. And they'll already be doing some of the good things, like they'll be using nasal sprays, which I need to do a whole separate video on nasal sprays, but medicated nasal sprays, not just saline, are really good at preventing a cough and reducing a cough. Not because they stop you from coughing so you can't clear your airway, but they stop you from making mucus so you don't have anything to clear from your airway. But anyway, these people will be doing everything right, but they're still having this drainage, and they're coughing and coughing and coughing and coughing. And they're like, I can't do anything. I'm so mad. I'm so upset. I wish I could stop coughing. My throat's killing me. And I'll just walk into the kitchen, and sometimes I'll do something as simple as just get some hot water, and I'll put it in a thermos, like a thermal cup, like a travel mug of some kind, and I'll bring it to them and say, will you just take a few small sips of this? Just a few small sips. And they'll take a few sips and they'll start coughing again. They had maybe just got their cough under control. And then I'll just take a few more sips. Come on, please, I need you to do this for me. Take a few more sips, take a few more sips. And all of a sudden they've dissolved that thick mucus. They've thinned it out to where now they can manage it. Now they can move it around. If I'm being really nice, what I'll do is I'll either add some honey. A lot of studies have shown that honey can actually trigger the same receptors in the throat that codeine does. And you know that codeine is one of the strongest cough medicines we have. Actually too strong now. It's not recommended to even use it anymore, but honey can hit the same receptors. And tea's got tannic acid, and tannic acid can help dissolve some of the things in your throat and out of your drainage. And even sometimes cinnamon's been shown to be an anti-inflammatory, but it's kind of hit or miss with this. Lemon, because the lemon's acidic, the acid again can cut through the mucus a little bit better. And then so maybe I'll mix like some honey and some lemon and some tea together, and nice and hot, and I'll bring it to them and I'll say, just small sips, small sips, small sips. And then we start to thin out that mucus that's draining down the back of their throat, and all of a sudden their cough's relieved. And well, it's kind of a pain in the butt to have to carry around this hot drink and keep making more when you run out of it, but it's more of a pain in the butt to cough. And remember, we don't want to stop coughing. We want to clear our airway. You want to be coughing. Another problem that comes from coughing is, well, you can really pull some muscles. You can end up with rib pain from coughing, neck pain. Your lungs, when I was a kid and I was watching, I don't know, Bill Nye the Science Guy or Mr. Science or whatever I would watch on TV, I used to hear the explanation that your lungs are like balloons. I used to think it was true that your lungs are like two balloons that just kind of expand, and it's kind of like this flimsy air-filled sac. But when you do a dissection of a body and you get to actually touch the lungs and feel them, the lungs are very solid organs. If you've ever felt like a ham you would cook at the holidays, that's what lungs feel like. They're very solid. And so when you cough and you cough and you cough and you're punching those lungs into your ribs and they have to rapidly expand and contract, you can get a lot of what we would commonly call costochondritis, which just means pain in the ribs, essentially. And you can get pains in your neck from jerking your neck from coughing so much and sneezing. And so what you really want to do is not be too prideful about your body and be a little more like you could just handle it. You want to be protective of your body. You could do the things we talk about increasing fluids, and you can try and minimize your cough, the amount you're coughing, by making your cough productive, so you're actually getting rid of mucus when you cough. But when you have to cough, there's some things you could do. Like, one of the best things you could do is hug a pillow. Hugging a pillow when you cough kind of reduces the impact on your rib cage. And then not having to cough so much because you're actually getting rid of the mucus helps reduce the impact on your rib cage. And then bracing yourself by putting your head back against something, or just laying flat, getting yourself braced, putting your hands down on something so that you can cough and keep your body still, can really help reduce it. And there's nothing a provider can do for you. And I'll let you in on a little something. Man, people go to the doctor's office and urgent cares to get antibiotics, and for the most part, well, they shouldn't be getting antibiotics, almost all of them, and for the most part they always leave with antibiotics. And why is that? Because providers are pressed for time. We have people who own the companies, the medical companies, that have no interest in seeing patients do their best. Their interest is in the bottom line. And so the more patients, the better. The pressure on all medical providers is to see more patients. And it takes 30 seconds to prescribe an antibiotic. And I've never had somebody say, do I need this antibiotic? Do I really need this? Most people, as soon as they hear that I'm willing to give an antibiotic, they're like, oh, they start grabbing their coat to put it on. That's all they were waiting for. And so they're much more likely to take an antibiotic and go. I've heard some rough estimates that it takes 5 to 6 minutes to explain to a patient why they don't need an antibiotic versus less than 30 seconds to prescribe an antibiotic. And usually the patient who leaves without the antibiotic isn't happy. They're not happy with their care that day, and they're more likely to go see somebody else. Basically, the sick population in our society, they're the ones that are causing, things like antibiotic resistance. Let's talk about some other things real quick that antibiotics do. You know, people love Z-Pak, azithromycin. Did you know azithromycin slows your heart down while you're on it? And you're somebody who's already prone to kind of skip a beat or have a slow heart rate, you can actually slow it down enough to where it stops and you die. People die from Z-Paks every year. Antibiotics cause horrible allergic reactions, even anaphylactic allergic reactions, and people die. Lots of data now showing that children who received a lot of antibiotics have a much higher chance of developing allergies and autoimmune diseases later in life. You could take something that was just going to be a normal viral upper respiratory infection, you give an antibiotic to it, and now you have upset stomach and diarrhea. A lot of times you'll take an antibiotic and you're like, oh, I'm not getting any better. You'll go and you get a second antibiotic, and now you're putting yourself at risk for yeast infections, C. difficile, C. diff, which is diarrhea that can put you in the hospital, could kill you, and it goes on and on and on. Oh, mono. You know what mono is called sometimes? Mononucleosis. It's called the great strep mimicker. It acts a lot like strep throat. It's got that glass in your throat feeling like strep throat. You know what happens if you give a penicillin with mono? You get a horrible skin rash, just a horrible rash. And we cause so much harm from giving out antibiotics all the time. And why do we give them out? Well, you could say because we don't have the backbone to stand up and do the right thing. But anybody that stands up and does the right thing quickly will find themselves out of a job. Those are just the facts. But mostly it's patients. It's you guys. Not you guys, because people who listen to this channel probably aren't the ones that are not trying to take care of their bodies as best they can. But people who don't know how to have a cold. You know, when you have a cold, I'm going to put a chart up right here. This is what it's like to have a cold. I don't have it completely memorized, but if you notice, you know, there's a certain, when you have a fever, that's part of just having a cold. 50% of people will have a sore throat on day 2 of a cold. Your sore throat is not an infection with bacteria that requires an antibiotic. It's normally viral. Half the people with a cold are going to have a sore throat. Coughing, congestion, look at the chart. 10 to 14 days. 10 to 14 days of coughing and congestion with just a cold. And people don't know how to handle it. I got stuff to do. I got places to go. I got people to see. I got things to do. I can't afford to miss work. I'm miserable. I'm not sleeping well. So you'd rather put yourself at risk of more harm to take a chance at getting better. Antibiotics can do nothing to help with a cold. Nothing. Viruses live inside the cells of your tissues. Bacteria live outside the cells of your tissues. The antibiotics do not go inside the cells of your tissues. They can never kill viruses. Even if they went inside, they wouldn't kill viruses. It's complicated, but there's nothing you can do to get rid of a virus, a cold virus. Oh, let's talk about over-the-counter cough medicines. Robitussin, Delsum, you name it. So there was a big study that was done where they took children with colds who were coughing, and they observed them overnight, and they gave, they would split them into 2 groups, a randomized control trial. Half of them would get a cough medicine such as Delsum. The other half would get a placebo such as orange water. It's something that looked like Delsum, but it was not Delsum. And so what did you see? Well, the 2 essentially did the same thing. You'll have to look the study up for yourself, but I believe it was roughly a 5 to 10% reduction in cough for both of them. There was no difference. They both reduced the cough. Now, some of the other medicines, like let's say NyQuil, has Tylenol in it. It has alcohol in it. Does Tylenol make you feel better? Yeah. Tylenol reduces sore throat, reduces muscle aches, reduces fever, can help you feel a lot better. Does alcohol make you feel better? Yeah. Alcohol definitely makes you feel a lot better. Most people, in moderation. Alcohol definitely can make you feel better. But do the other ingredients that are supposed to, ingredients like dextromethorphan, that's the DM, you see, have they been shown to do anything to reduce a cough? Nothing. So you can take those over-the-counter cough medicines to make you feel like you're doing something, or you can give them to your children and loved ones to make you feel like you're doing something, but it's all psychological, it's all emotional. You're not actually doing something. So in another study, I'll try and link all these studies in the comments below so you can read them for yourselves. Remember, I don't give medical advice. You should never take any serious advice. You should never take advice about anything serious from anybody on the internet, and you should see your own healthcare provider for your medical advice for yourself. But you can read the studies. You can be an educated person. The study showed what does reduce a cough. Well, increasing your total fluid intake reduces cough. Why? We're thinning the mucus. Now we can manage the mucus. Increasing household humidity. Well, let's talk about how much water you need. So if you take, this is a rough estimate, but if you take half your body weight in pounds and then that many ounces, that's how much water you should drink. For example, if you weigh 100 pounds, you should try and drink 50 ounces of water every day. If you weigh 150 pounds, you should try and drink 75 ounces of water every day. If you weigh 200 pounds, you should try and drink 100 ounces of water every day. And that's on an everyday basis. When you're sick, you need to increase your fluids, increase your fluid intake. And I won't get into the argument over if that should be water or if other fluids are okay, but I will say milk, dairy products tend to thicken the mucus, and they should probably be avoided when you have a cough. Increasing humidity was another thing that reduced coughing. And what does that do? Well, it thins the mucus so you can manage the mucus. It's all about mucus management. And the CDC actually did a report, and they found that ideal household humidity is 43% for the prevention and treatment of colds and flus. So do I keep my house at exactly 43%? No, that's ridiculous. But I do have a household humidifier that I installed on my furnace, and I also have another furnace in the children's room, and I also have another humidifier in the children's room. And so I try and keep it roughly between 30-35 at the low end. I don't like it getting any lower than that, up to 50 or 55. And once I start to get on the high end, the thing that's a dead giveaway that it's getting kind of high is I start to get a little bit of condensation on the windows. That lets me know that it's been getting a little bit high. But I try and keep it close to that 43%. And then you could do like some acute high humidity by taking a shower. Or for a child, you get in the bathroom and crank the shower up on high heat, and you take them in the bathroom and you hold them up in that steam, let them play around in that steam, and break it up. For newborns, you can get a syringe and fill it up with sterile saline, and you could put like a drop in each nostril, wait like 30 seconds, put another drop in each nostril, wait like 30 seconds, put another drop in each nostril, and what you're doing is thinning the mucus so it can flow back into the throat. Once it gets back into the throat, the child doesn't have to worry about sniffling, blowing their nose, swallowing. The body automatically takes over and can manage the mucus and get it down to the stomach where it can be taken care of. But you're not going to get any infant to blow its nose. You can also do the suctioning. Oftentimes I've found that saline works fine on its own, but you could do the saline first to thin the mucus out. If you like the suction bulbs or one of the nose Fritas or any of those, you can use them, but oftentimes you'll find that they're not very effective. You're not getting anything out, even though you know there's stuff in there. It's because the mucus has gotten too thick. What you need to do is thin out the mucus first by doing the saline drops, and I find the syringe works best. There are some aerosolized nasal saline you can use that work well too, but you thin the mucus out with saline first, and then you can use the nose Frida or the suction bulb to suck it out. Or a lot of times, what I'll do is, when my son was a newborn, I would put his pacifier in so he was forced to breathe through his nose, and then I would plug one of his nostrils. I would just plug one after I put saline in, and it would force him to breathe through that nose, and he would either wiggle the mucus out, and I would grab it with a Q-tip, or he would swallow it back, and he would have a clear nose. If you want to talk about medicines you can actually take for a cough, real briefly, here are a few you should think about. One, and an intranasal steroid. That would be Flonase, Nasacort, Nasonex, one of those. I personally don't recommend Rhinocort because Rhinocort has failed to remove the medicine smell, and if you use Rhinocort, you're probably going to swear to never use a nasal spray again for the rest of your life. So I recommend one of the others. You can use, and remember, those decrease congestion and decrease mucus production. I have so much to say about those nasal sprays. They have to be a completely separate video, and I'll try and get to that soon. Another thing you can use is Mucinex, which originally came out as Mucinex. The medicine's called guaifenesin, and guaifenesin is not a cough suppressant. It's an expectorant. It takes your body's formula for mucus, which mixes mucin and water, and it makes it add more water to it. So its whole point is to make you cough more, but make you cough more productive. It makes your mucus thinner so you can actually get it out. So when you cough, it doesn't hurt. You're actually coughing stuff up. You're actually breaking things loose. I think anybody who's sick should take Mucinex, not to reduce your cough, but to make your cough more productive cough. And then not Mucinex. I don't ever buy name brand hardly anything. Guaifenesin. Just get the guaifenesin. Pseudoephedrine, not Sudafed PE, which is garbage. But the actual Sudafed that in most states you need to take your driver's license and show to the pharmacist to prove you're not running a meth lab, and take it. And the pseudoephedrine comes in 3 varieties usually. There's a 24-hour extended release, and there's a 12-hour extended release. And if those are the only 2 you have, get the 12-hour, because both the 12-hour and the 24-hour give you a relief for about 12 hours. But with the 12-hour one, you could take another one 12 hours later, versus the 24-hour one, you cannot take another one 12 hours later. And even better would be if they have a 60 milligram immediate release version. That one you can take every 4 to 6 hours, and that one works really quick, and that one can kind of just be taken as needed, and that's the one to take. There's another medicine that's kind of old. It's for only ages 10 and up. Benzonatate, or Tessalon Pearls is the brand name it came out as, and that one is supposed to try and numb the kind of reflex here, so that you don't have that nagging need to cough. I'll tell you a couple things. One, about half the people I give it to tell me I might as well give them Tic Tacs because it didn't do anything. And 2, do you really want to numb your gag reflex? Do you really want to numb your ability to cough? I don't know that it's the greatest medicine you can take. Anyhow, these are just some thoughts about a cough. Well, I venture to think that there's some very brainy pulmonologists and other people, allergists, that could probably talk to you for dozens of hours about a cough. But we'll cut it off here for now. Everybody take care.